All right, we're moving into position number 4. Now this one is to address the right side, which typically rolls forwards. When we test people here in the clinic and we start to bring the knee towards the chest, a lot of time they'll get a pinch right here in the front of the hip. And what's happened there is because the pelvis has rolled forwards, it's actually closed down the joint space in the front of the hip. So they actually run out of room from a bony anatomy perspective much earlier than if the pelvis is symmetrical in its normal resting position. So the way we do this is kind of seems backwards, but it's called a relative rotation, where actually we're going to move the upper body further so the relative rotation happens in the pelvis to move backwards. What that looks like at home is probably kitchen table and chairs, the office desk in a chair, anywhere where you can get the foot elevated and kind of lean your elbow down on something is going to be a great place to accomplish this. And so the right leg is going to go up, and it's actually going to flare about 45 degrees to the side. Okay, so we don't want to be straight on. We don't want to be way out to the side. Somewhere right in the middle. Then your left elbow is going to rest on whatever surface you've got to rest on. Okay. Then the magic happens when you actually let this shoulder and hand dip down towards the ground. This rotational piece really actually creates a pretty aggressive windup in the right hip. Most people think this is the most aggressive position in terms of how it feels in the moment, but a lot of times offers the most relief just after a couple of minutes. So, and we'll talk through how you're going to use some of these positions individually in just a minute. But this is another 2-minute stay. I will caution you, because this one is the most aggressive, this one especially, stand up a little slower, bring the leg down slower. You might give it a little shake to kind of break that stiffness out of there from the position you were in. So you're going to spend 2 minutes there. And before we want to move on to our final position in the Keystone Reset program, I just want to share with you some things that we hear very commonly from clients here in the clinic. And that is that position 1, so the side glide dysfunction, typically offers a lot of relief just doing the 1, okay? The next thing we hear is that position 4 offers a lot of relief just doing that by itself. So what I want you to know is that at any point during the day, you can do any one of these positions by itself, especially if it offers you tremendous pain relief just inside that 2 to 5 minute stay. That's totally fine. We want you to utilize these to help minimize your pain so that you can get through the day with a higher quality and less focus on the pain itself, all right? But we do need you to know that at least one time a day, we need to go 1, 2, 3, 4, 5 back to back all at once. And the reason why is that if we just consider the total dysfunction to be these 5 positions, if you only restore the 1, the other 4 that are left in dysfunction will force the one you solved back into dysfunction. So at least once a day, we want you to go 1 through 5, follow the time frames, and do them in order. There is a specificity to the order we go in. And what that does is it just puts all the pieces of the puzzle in place and creates a better symmetry in the overall pelvis rather than just one joint that may affect your pain to a higher degree. So I hope that makes sense. We're going to move on to position 5. This will be our final position. We'll see you there.